increasingly common and can range from occasional symptoms to chronic disease. Symptoms can include a scratchy or gritty feeling, redness, fluctuating vision or blurriness, tired eyes, and eye irritation. So joining us today is Dr. Christopher Starr, a refractive and cornea surgeon, and Rebecca Petrus, president and co-founder of Dry Eye Foundation, to talk about the symptoms and treatment options. So welcome to the show, guys.
Thank you. Happy to be here.
Now, first of all, what is dry eye and what causes it?
Well, dry eye is kind of what it sounds like. The eyes tend to get very dry, and that's usually due to either a decrease in tear production or tear volume, or a production of unhealthy tears that tend to evaporate very quickly. And we often find that it's a combination of both of those things. And there are many, many variables and factors that can lead to dry eyes, everything from age, which is a common risk factor for many, many eye conditions, hormonal changes as we get older, but we are also seeing it very commonly in younger patient populations like teenagers, kids, and young adults. And the main driving factor for that is computer use. We spend most of our time on computers on a day-to-day basis, and the lack of blinking and the staring at computers can have a toll on our eyes and lead to dry eye symptoms and dry eye disease in some cases. But there are plenty of other things, other medical conditions, autoimmune conditions, medications that we all take on a day-to-day basis can contribute, in addition to dietary influences, environmental lifestyle challenges, things like that all play a role when it comes to dry eye disease.
And what impact does dry eye have on our daily life?
From a patient perspective, there's dry eye and there's dry eye, right? So there's these really mild symptoms anybody can get that aren't necessarily going to affect your life. You just experience them as a nuisance now and then under certain conditions. Then there's the real deal where you've got symptoms that are persisting and your eyes are uncomfortable literally all day long. So people are going to experience this differently. For some people, it's going to be burning, stinging. Others, it might be grittiness, or they actually feel dry or gravelly. Others, it might actually be watery eyes. It might be intermittent blurry vision. It might be light sensitivity. It might be just a feeling of your eyes being tired all the time, or your lids being very heavy. Whatever it is, or whatever combination of those, when it's persistent, that's going to pretty much affect everything. So working when your eyes are constantly uncomfortable becomes very difficult, especially for the screen-focused jobs that so many of us have these days. Driving can be a problem. Being outdoors, just doing normal day-to-day life things becomes a whole different matter when your eyes are always uncomfortable.
How can people manage their symptoms, and how can symptoms progress over time?
There's like a parallel path through this. There's a medical side to it. We want to see people getting to their eye doctor early in the progression of this. And then there's a practical side of it. How do I keep myself comfortable all day? And Dr. Starr has a ton of practical tips and information on this.
We're here to tell people that there's no need to suffer. If you have any of these symptoms, you should see an eye doctor, and we have great treatments for this. Like you said, it can progress over time if untreated and undiagnosed. So we always encourage people to see an eye doctor sooner rather than later.
Where can we go to learn more information?
Bausch and Lomb created a great website called knowyourdryeye.com, which is a great resource for people looking for more information.
Guys, thank you so much for all the tips and all the insight on dry eyes. We appreciate it.
Thank you.
Thank you, Lisa.